So, and what do you see as some of the other big factors that can lead to infertility?
Well, as mentioned previously, the sperm quality is one of the biggest ones because it's the 50% of the equation, and its importance seems to be largely ignored, which is very frustrating for women because they feel like all the eyes are on them and all the issues have to do with their eggs. Now, the world-renowned professor of reproductive science from Newcastle University in Australia, Dr. Aitken, criticized the IVF industry for ignoring the fact that the failure to conceive stemmed largely from male fertility problems. And it's also a very little known fact that sperm analysis parameters are constantly changing. What's considered normal morphology today would have been deemed infertile a few years ago. And the frustrating part is that the sperm quality issues are a lot easier to treat as 3 months. And much of it boils down to diet, lifestyle, supplementation, but it depends on knowing which underlying issues need to be addressed. And it usually just requires a targeted approach to address the specific issues. And the other overlooked area is your environment and your emotions are very important factors when you start trying to conceive. They have to be addressed as well, which is why we evaluate all the factors at the beginning of the program.
Um, Absolutely. I mean, thank you for bringing up the environment and emotions and emotional factors. I mean, what's more stressful than dealing with fertility challenges? I mean, I think it'd go right up there with all the huge other, stressors in life. I see it can be quite devastating for a couple who is struggling. Now, I just noticed that your audio was going a little bit in and out, and maybe it was just on my side, but it was fading in and out a little bit.
Right.
Yeah. If there's anything you can do on your side. So, I noticed that a lot of couples struggling with infertility, of course, they get the sperm quality checked, and if the tests come back, quote unquote, okay, then the man is considered not part of the problem, and then he pretty much feels like, well, I'm fine. It's all, like you were saying, it's all the women, the woman's issue. Can you discuss this further?
Yeah, sure. That's a great question. And it's very true that if sperm parameters are borderline or, in the normal range, but literally borderline, sperm is not considered to be an issue. And many clinics don't even routinely check for morphology. And I've seen many sperm reports without morphology values. Now, morphology is important because morphology is the shape of the sperm, and the sperm have a very specific shape, which enables them to swim and to penetrate the egg. And when they don't look like little rockets, then they can't do their job. And the really scary part here is that only 4% of sperm need to look normal or have normal morphology for the sperm analysis to be normal. So 4% of anything doesn't sound like much to me, and it means that 96% of the sperm are abnormally shaped and can't reach the egg nor penetrate it. So I think it puts it into perspective why it's so frustrating when a couple are trying to conceive and they're not successful and everyone is telling them there's nothing wrong with you. So if that's you, if your morphology is around 3 or 4%, then this is really something you need to work on.
Absolutely, 4%. That's crazy. And like you said, men are fortunate. If that is the case, if that's the case with your partner, there's so much that you can do to remedy that, right? I mean, I don't know. I don't want to say it's easily correctable, but I know that it's very treatable. And
absolutely, yeah. It's it takes 76 to 90 days to address sperm quality, so it's easier to treat in that sense. The part that's harder with men is, for most men, it can be quite difficult to change their lifestyle or change their diet. Not for all, some are extremely motivated and they just do it, but you do come across those who are just, you know, they think, I'm not the one who's going to be pregnant, so why should I change? So sometimes it takes a paradigm shift, but that's probably the biggest obstacle. And just, yeah, being told there's nothing wrong, no need to change.
Absolutely, and you said that a lot of times you'll look at sperm quality tests, and they won't even check the morphology. So for people, for those of us who are listening out there, I mean, if the test is it isn't too, like, it is a fairly recent test, you can at least look at it and make sure that they check the morphology, because that's extremely important, right? I mean, they could see if that was tested.
Yes. I mean, for natural conception, it's extremely important. For IVF, again, they may check it to see if ICSI is a better option than IVF, but they can maybe tell already from other parameters that the sample is not going to be good enough for IVF, so they go straight for ICSI. And some clinics just do ICSI, which is where they inject the sperm into the egg cells, so that you're bypassing the natural selection process there as well. But yeah, if you've been through IVF and it failed, or you've been through ICSI and it failed, and you have some sperm reports at home, have a look, check if morphology was checked, and if you've been given the option to use donor eggs, because they won't even do another IVF with you because you had so many failed cycles, or because of your age, or you simply can't afford to do another IVF, so you're looking at other options. You need to know that the sperm are good enough for natural conception, and morphology is important for that.
Okay, thank you. And just to reiterate, when they're looking at those sperm tests, they can only be how old before they're considered obsolete at that point?
Well, anything older than 3 months, like I said, is not really representative of the current situation. So if you have a sperm analysis from 2015, that's not really going to tell you much about today. But, if you have multiple sperm reports, from 2015 and 14, and the same issue is repeating, then you can be pretty sure that unless you've been taking some supplements, making dietary and lifestyle changes, that that issue is still going to be present. So yeah, you just want to repeat the analysis if it's older.